Hello, welcome to Public Health Nursing BSN DNP information session. My name is Dr. Tasha Turner-Bicknell, and I'm the program director for the brand new program here at UC College of Nursing in Public Health Nursing. This is a BSN to DNP program, and we're going to talk a little bit more about what that means today. I'm joined by Bobby Rue. He's our senior admissions counselor and always here to answer any of your admissions questions as well. You can reach out and contact him. We have our email and contact at the very end of this presentation. So what are we going to talk about today? We're going to talk a little bit about the course requirements and the length of the BSN to DNP and Public Health Nursing program. We'll also talk about our Public Health Nursing Post-Baccalaureate Certificate program and some admissions information as well. Why choose UC? If you're watching this video, you're most likely in a position where you're thinking about what your next move is going to be, where you want to go for graduate school, what kind of program do you want to do. At University of Cincinnati College of Nursing, we are nationally ranked for quality. We're in the top 4% of all nursing programs in the United States. We have over 130 years of nursing education. We have doctorally prepared faculty that are still practicing in our respective fields that teach our courses. And we also have flexible scheduling. We have priority doctoral funding. We are a designated National League of Nursing Excellence, Center of Excellence. And we also have 100% online coursework. These are all things you might be thinking about. I'll tell you a little bit about myself. As I mentioned, I'm Dr. Tasha Turner-Bicknell. I have a DNP. I've been an RN for about 16 years, and I'm also certified in public health. My background in cultural anthropology has provided me with an appreciation for the diversity of lived experience. I'm committed to equality, social justice, and healthcare reform. My doctoral work included the research, review, and implementation of best practice recommendations for a local syringe service program. I understand the importance of developing culturally competent public health interventions that provide low threshold services to our most vulnerable populations. So I do a lot of work in harm reduction, syringe service programming, overdose death prevention, drug user health, public health, and health disparities. Just to tell you a little bit about me. So the academic requirements. To enter this program, you need to have a BSN or an MSN from an ACEN, formerly known as the NLNAC, or CCNE accredited School of Nursing, a recommended overall GPA of 3.25 or higher. We'd like to see that high GPA, but we do want to emphasize as well, we're going to talk about it a little bit more, that we use holistic admissions and that there's not one criteria that's really feeling like you're going to get knocked out of being eligible for the program. If you're interested in the program, we're going to look at all of the characteristics of the applicant. You need to have taken a statistics course and earned at least a C. We do not require the GRE for this program. It says optional here because sometimes we'll have candidates who have taken it and want that to be considered as part of their admission criteria. And that's fine, but you don't need to pay for that or seek that out and take that if you have not already. The GRE is not required. The program length, the DNP, the BSN to DNP is 77 credit hours, 8 semesters of full-time study, part-time study, 11 semesters, and you need to complete the program in a maximum of 5 years, and that's pretty common for a lot of our graduate programs. So let's talk a little bit about the DNP Prepared Public Health Nurse. It's something that a lot of people out in the general population don't really know a whole lot about. The Dnp Prepared Public Health Nurse works to apply evidence from research to design, implement, and evaluate population-based interventions. At the heart of the confusion sometimes is the difference between PhD and DNP. If you're here looking at a DNP program, you've probably already sifted through some of those considerations, the PhD being a research-focused degree, doctoral degree, and the DNP being that practice-focused doctoral degree, where we're bringing the evidence from research to the point of care or to practice. That public health nursing is something that's available to any RN. So what makes the DNP, the doctorally prepared public health nurse, different? Doctorally prepared public health nurses are ready to assume leadership roles at the local, state, and federal level, at public health agencies, health systems, non-governmental organizations, and oftentimes also leading and directing grant-funded public health initiatives. So let's walk through the curriculum a little bit, take a look at the schema, see what the layout of the courses looks like. In the first academic year, that first semester, you'll take Principles of Population Health and Social Determinants of Health. The Social Determinants of Health course is really important. It kind of sets the foundation for a lot of the coursework that you'll do during the time that you're with us. As most of us know who are practicing as RNs, the social determinants of health can have some of the biggest impact in our patients' overall health outcomes. You'll also take DNP role seminar, where we talk about the role of the DNP and kind of bring you into the fold with what a DNP is right away. Principles of Population Health is really an introduction to population health, where the population is the unit of study. Whereas if you are in the hospital working at the bedside, you're working with one individual client at a time. Here you are working with a population, a group, or an aggregate of people, which is the client or the unit of study. The second semester, you'll look at Principles of Public Health Negotiation and Mediation. Negotiation and mediation is a big part of public health work in two ways: helping the public understand their risk that is inherent in their community or among their population, and to take actions to protect themselves from that risk. And then also trying to work with community decision makers, oftentimes political leaders who may have no public health experience. I think we're all kind of acutely aware of these negotiation and mediation pieces after living through a pandemic. We've seen some of this play on the national stage, but we certainly see it on the local level as well. Epidemiology, epidemiological methods in healthcare. This is an epidemiology course that is kind of focused on the healthcare professional, looking at epidemiology from the perspective of a public health nurse. And population density, where we look at implementing public population health interventions in both the rural and the urban setting. There's a lot of similarities between those two settings, and also some specific considerations. Additionally, with this program, you'll take some courses that are external to the College of Nursing. We're very fortunate here at the University of Cincinnati to have a large, Research One institution with a lot of other programs that we can access and leverage to meet the needs of our students. This is one example. We partner with what is an ERC, an Education Research Center for Occupational Health Nursing here at the College of Nursing, and also at University of Cincinnati. And we are able to take this interdisciplinary course, which is Environmental Public Health. Then in the third semester, you'll take some what we call Dnp Core coursework. So these are courses that are taken by all Dnp students here at the College of Nursing: theoretical basis for clinical reasoning, quality improvement in patient safety, and biostatistics for evidence-based practice. I just want to go back one slide. No one, oftentimes, I shouldn't say no one, but it's an occasional student that says to me, I'm really excited about taking more statistics. That biostatistics course for evidence-based practice is really intended for nurses. It is to think about biostatistics in the context of evidence-based practice and generating interventions that are informed by data and statistics, so that we can improve outcomes and monitor trends. All right, looking at the next semester, this is when we start the public health nursing practicums. One thing that is unique about our program is that we have 3 practicum courses. Public Health Nursing Practicum 1, 2, and 3 provide students with the opportunity to partner with a public health partner in their community and do practicum hours. All BSN to DNP students will complete 1,000 practicum hours to complete their DNP. If somebody has, let's say someone has a master's and they come in to do maybe a DNP program, an MS in the DNP program, maybe they're already a nurse practitioner, they want to come in to just do that piece. That's 500 hours. But then if you're going from the BSN to the DNP, you need to do 500 more, which are often completed in that master's coursework. So we built those 500 hours into our program in Practicum, Public Health Nursing Practicum 1, 2, and 3. You'll also do an interprofessional field experience in occupational health that has a remote and an in-person option. So for people who are in the area and want to come and do that interprofessional field experience in person, you may have that option. And we also definitely have a virtual option as well. And that's just 1 credit hour. Then we take 2 Dnp Core Courses, Essentials in Research Methods and Informatics. Then moving on to, you'll take the second practicum, Public Health Nursing Practicum, where you're kind of leveling up your engagement with your public health organization, maybe looking at some initiatives that they've been trying to launch or in the process of launching, and seeing how you can improve them or help them evaluate their effectiveness. And it may be with the same organization that you partnered with for Practicum 1, or you could have the option of partnering with a different organization. And I'm always available to talk to students about how to design that and kind of coordinate it so that it meets your personal needs. Our Dnp Core Courses, Planning, Management, and Evaluation of Programs. That's a really important course for that public health nurse, the DNP prepared public health nurse. A lot of what we do is quality improvement and evaluation of programs. We're always looking to see, you know, how effective is this program and how can I make it more effective? Healthcare policy. And then in the next semester, the principles of public health ethics, equity, and advocacy. As most of us are acutely aware, the last 2 years, the United States has a lot of work to do in the area of equity, and health equity is no exception. Looking deeply at what drives health disparities in the United States and what type of advocacy and commitment to ethics is required to try to work to reverse those health disparities and to ultimately eliminate them, which has been a goal of Healthy People since its inception. Public Health Nursing Practicum 3. Again, you're almost, you know, you're also taking Dnp Practicum 1 when you're doing Practicum 3. And in Practicum 1, you're also laying out what you're going to do for your Dnp project. So in Practicum 3, you're kind of, you're looking at maybe the budget of the organization you're partnering with. You're looking at evaluating their interventions. You're looking at possibly maybe launching an intervention with that group yourself, maybe, you know, designing a program or helping them launch a program that you have helped them select, that kind of leveling up from Practicum 1 and 2. And this also kind of sets the table for your DNP project. Some students in Practicum 3 might be thinking to themselves, this is the organization where I want to implement my DNP project. Some students might not. They might think, you know, I've had a good experience here, but I'm going to do something else with someone else. And that's okay too. But really kind of gaining that experience, those 500 hours are coming to a close and you're launching into that DNP Practicum 1. And in Dnp Practicum 1, you you lay out your project, what you're going to do in your DNP project. You, of course, present that to your course faculty, and we give you feedback and help you refine it and kind of get it into a position where we think, you know, like, yes, this is a really good project. And then you will present it to a group of faculty and peers here at the college remotely often. And get that feedback, and then it'll be approved, and then you'll work on that project moving forward because you just have 2 semesters left. So you kind of design the project in Dnp Practicum 1, and then you're going to implement it in Dnp Practicum 2. At this point in the program, you're going to take leveraging analytics and business tools for healthcare. I think that's a really exciting course, and it's extremely relevant in public health. We're always using the term data-driven. You know, the work that I do, I want it to be data-driven. I want it to be creating programs that respond to the analysis of data that we have so that we can monitor trends and address health needs. And using analytics and business intelligence tools is an important part of that. Leadership seminar, and also Practicum 2, where you will implement your DNP project. In the final semester, you will take global health, which is a graduate course that we have here, which has a study abroad component. You do not have to do study abroad by any means to take this course, and it is distance learning, but you may have the opportunity to participate in a study abroad course at that time if you are interested in it. And there'll be more information about that if you're in the program. And as we're, registering and getting closer, we'll let you know, where they're going, what the cost is, what some of the potential plans might be, and you can make that decision. Dnp Practicum 3 and then Manuscript Writing Seminar is a course where you will work closely with a faculty member to create a manuscript for publication based on your Dnp project. We also have another track under the umbrella of public health nursing here at the College of Nursing, which is occupational health nursing. Occupational health nursing is a specialty of the specialty of public health nursing, and it is focused on the health and safety of individuals who are on the job, to put it simply, in the simplest of terms. As you can imagine, we spend a great deal of our life at work and thinking about the risks that are inherent in the environment and protecting workers from that risk, and looking at overall health and wellness to improve the functionality and health of people on the job is extremely important. You'll see here, you take a lot of the same courses from the public health nursing program, but you will add in some specific courses that are tailored to occupational health. What I would say about occupational health nursing is, if you are really interested in working in that space, reach out to me, and I'm happy to meet with you. And we have another faculty member, Dr. Gordon Gillespie, that also has a lot of experience in that program. And we can talk with you directly about what the program is and what some of those roles look like on graduation. So the biggest difference in this first year is that occupational health, hygiene, and safety workshop. That is an interdisciplinary course that is taken at the NIOSH ERC. So NIOSH stands for National Institute of Occupational Safety and Health, and the ERC stands for Education and Research Center. We have one of the longest standing and continuously funded NIOSH ERCs in the country. And I'll talk a little bit about that here in just a couple of slides. You'll also take, this course, the ERC is made up of engineering, industrial hygiene, medicine, and nursing. And that hygiene and safety workshop is an interdisciplinary course where you'll be in the same course with those other disciplines. Also, in the third semester, you'll have occupational environmental diseases and injuries. And then occupational workshop 2, occupational safety and hygiene workshop 2, the same interprofessional field experience that students in the PHN, public health nursing program, will have. Also taking role seminar and essentials of research methods. And then Practicum 2, these students in this program will also need to accumulate 1,000 hours by the end of the program to achieve the DNP. And so we've built those hours in here as well with the workshop course, occupational workshop, and then PHN Practicums 2 and 3. And then also taking planning, management, and evaluation, and principles of public health ethics, equity, and advocacy, and then Dnp Practicum 1. Semester 7, leveraging analytics, the DNP seminar, and Practicum 2, Dnp Practicum 2, and then the population density course, which is a public health nursing course as well, but they're taking it here towards the end versus at the beginning for some of our other students, and then Dnp Practicum 3 and the manuscript writing seminar. So this track 2, the occupational health nursing track of this program, the UC Education Research Center is a really important part of our occupational health nursing program. I'm an alumni of this program. I'm happy to talk to anyone about it who's interested, and can refer you to Dr. Gordon Gillespie if you really want to hear about opportunities to apply. The UC Education and Research Center was among the very first ERC to be funded by the National Institute for Occupational Safety and Health. It has been continuously funded for 45 years, since 1977, and it's the oldest center in our university. It is an interprofessional program with faculty and students from occupational health nursing, occupational medicine, occupational safety and health, engineering, industrial hygiene, ergonomics, and biomonitoring. Students participate in coursework and clinicals in collaboration with students from these other programs. Here's a great picture of some of our graduate students, and this is Dr. Gillespie right here, smiling with his students. The public health nursing Dnp Practicum hours, I've already touched on this a little bit, but this gives you a nice summary to kind of take away. Students complete a minimum of 1,000 post-baccalaureate practice hours. The American Association of Colleges of Nursing, that AACN that we're often referring to, puts forth the essentials of doctoral education for advanced practice nursing. Students from both tracks will complete the Dnp Practicum courses for 500 practice hours. Clinical practice experience provides students with the opportunity to apply new knowledge and demonstrate the achievement of course outcomes under the auspice of Practicum course faculty. The other thing that I think the Practicum hours really do for you is they also help you build a public health resume while you're in the program, which I think is really valuable for the BSN to DNP nurse. Practicum course faculty work closely with clinical partners to supervise and support the student in the professional setting. So looking at what these practicum hours look like in public health nursing, you'll take practicums 1, 2, and 3, the public health nursing practicums and the interprofessional field experience. Students will demonstrate the achievement of those DNP essentials established by the AACN for a minimum of 500 practice hours. On track 2, the occupational health nursing track, you'll take public health practicums 2 and 3, and then 2 workshop courses, 1 credit of each towards practice hours and 1 credit towards didactic hours. 1 interprofessional field experience course, and you will also have a minimum of 500 practice hours. And here are some of our graduate students right here from previous years on touring at an interprofessional field experience there. So now let's talk a little bit about the public health nursing post-baccalaureate certificate. This is a great picture here. This is a picture from one of our study abroad programs where I have students with me in Japan, and we are participating in a high fidelity tsunami simulation. Here's my colleague from Japan, Dr. Umeda, who is coaching the students with how to put their feet into the simulator and get started. So the public health nursing post-baccalaureate certificate prepares professionals to apply knowledge, skills, and abilities to advance their career in public health. The coursework includes principles of population health, social determinants of health, leveraging analytics and business intelligence tools for healthcare, and the population density course, which, as I mentioned before, really focuses on the innate needs of both the urban and the rural setting. So why the DNP? You can be a public health nurse. There are public health nurse positions that are not DNP prepared. So why a DNP? It's designed for nurses that are seeking a terminal degree in nursing practice rather than a research-focused doctorate. The Doctorate of Nursing Practice programs prepare students to translate the evidence from nursing research and other disciplines to practice and improve health outcomes. The DNP coursework culminates in a student-driven DNP scholarly project. The DNP prepared public health nurse is ready to navigate the multiplex of public health systems and implement public health programs based on science. We are essentially, I think my doctoral work is a good example. I did my doctoral work on best practice recommendations for syringe service programs. Syringe service programs have been around since the 80s, and there was a tremendous body of evidence to support their effectiveness, but they weren't being implemented in my community, or they weren't being implemented effectively. So my project focused on not new research, but instead on taking that research and saying, let's bring this to the point of care, let's implement this and improve patient outcomes. So we admit every fall the nursing application, that CAS application. Holistic admissions is our focus. Every element counts. We look at GPA. You have the opportunity to retake courses if needed. You want to have a clean, ready to go personal statement. Your resume, your CV, your recommendation letters should be strong, and then you'll also have an interview. Bobby, is this a good opportunity for me to introduce you and have you come in?
That's great. Thank you. Thank you. Thank you for watching our recording, everybody. My name is Bobby Rue. I'm the admissions counselor for both the DNP, Public Health Nursing, and the certificate. We're not including deadlines on this particular recording because these things change all the time. And you might be viewing the recording in the future, maybe after fall 2022 is closed and you're looking for the fall 2023 term. But currently those are open. If you'd like to view details about the application, just go to the University of Cincinnati Nursing website, either for the DNP admissions or their certificate admissions. They do have slightly different deadlines, but basically the requirements are the same. They're pretty much listed there. So once you start your application in NursingCAS, you'll receive an email from me with my contact information. If you'd like to set an appointment with me, just respond with some availability and the best phone number to contact you at for a phone appointment. Otherwise, it's a pretty simple process. I've been in NursingCAS for about 4 years, so I'm used to working with applicants on this. And then basically, just to reiterate what Dr. Tasha Turner Bicknell has already said about our programs, we're very proud of our program structure. The online course structure has been ranked consistently in the top 15 in the nation. It was number 7 at that point, but it's a great program. We have a lot of transfer requests into our program because of the asynchronous learning opportunities. There aren't any campus visits required at this point in the DNP program, but we do invite you to come onto campus. I'm sorry, except for those field experiences. Sorry about that. This is a new program, so still getting in my head. But we do invite you to campus to present your DNP project, which typically takes place the week that you graduate. So you're probably going to be here anyway. So wherever.
And I just want to jump in. The field experiences are to have a remote option, so it is a 100% distance learning program.
Thank you. Yeah, again, Carnegie Research One institution, consistently top ranked. Yeah, and funding, definitely funding. If you're looking at funding, apply early in the term for that because there are deadlines to that. If you've got questions about deadlines, just contact me and my information's on the next slide.
Absolutely. Well, thank you so much. Again, you can contact either one of us at any time. Bobby is your go-to person for any admissions questions, kind of shepherding you through that admissions process. I'm always happy to talk to students about anything related to the curriculum, any questions I can ask you or answer for you about the demand in the field, what the role looks like in practice. I'm always happy to meet with students as well. So please don't hesitate to reach out. And thank you for listening to our information session.
Thank you.